Now it's time to talk about our sixth biomarker, which is susceptibility and risk biomarkers. They provide valuable insights into your likelihood of developing a specific gastrointestinal disease. By identifying these biomarkers, our healthcare providers can implement early interventions, preventative measures, and personalized monitoring to manage our gastrointestinal health proactively. Now let's look at some key susceptibility and risk biomarkers for various gastrointestinal conditions such as stomach cancer, colorectal cancer, and inflammatory bowel disease. Let's start with susceptibility and risk biomarkers for stomach cancer. Stomach cancer or gastric cancer is a significant concern in gastrointestinal health. Certain biomarkers can indicate an increased risk of developing this disease. So, two biomarkers: one, H. pylori infection biomarker, two, E. cadherin CSD1 gene mutations. H. pylori infection biomarkers are measured through breath test, stool antigen test, and blood test. A non-invasive breath test or stool sample is often used to detect H. pylori infections, while blood tests can identify antibodies. E. cadherin CDH1 gene mutations measured through genetic testing. It can be drawn through blood or saliva and analyzed for mutations in the CDH1 gene. So presence of H. pylori indicates an increased risk for stomach cancer and peptic ulcer. I have had H. pylori, then the treatment plan for H. pylori is 7 days of antibiotic and then it's gone. So it's very common. But also if there is a presence of H. pylori, it increases the probability of the likelihood of stomach cancer. So E-cadherin CD1H1 gene mutations in the CD1 gene are associated with higher risks of hereditary diffuse gastric cancer. Then identifying these biomarkers allows for early interventions such as H. pylori eradication therapy, which I went through, and regular endoscopy monitoring for individuals with CDH1 mutations. And obviously, absence of these biomarkers reduces the likelihood of developing stomach cancer. But again, regular screening and monitoring are essential, especially if we have the family history of it. So important note to add is, so genetic testing for CDH1 mutation may not be routinely recommended for everyone. Therefore, it's important to consult with a healthcare professional for a personalized medicine. It's a personal discussion with your provider. We are providing this information for you so that you can have a conversation with them. This is not a medical advice from me. Now, let's talk about susceptibility and risk biomarkers for colorectal cancer. So, colorectal cancer is another critical area where susceptibility and risk biomarkers play a significant role in early detection and prevention. So, two biomarkers we're going to talk about are APC gene mutations and two Lynch syndrome biomarkers, MLH1, MSH2 gene mutations. And these are done through genetic testing. For APC gene mutations, a blood sample or saliva, and for Lynch syndrome biomarkers is to blood samples to identify mutation in mismatch between repair genes associated with Lynch syndrome. And presence of mutations in APC gene indicates a high risk for FAP and colorectal cancer. And mutations in mismatch repair genes, MLH1 and MSH2, are associated with the increased risk for colorectal and other cancers. And obviously, if these mutations are identified, then it allows for targeted preventative measures such as increased surveillance, prophylactic surgeries, and lifestyle modifications to reduce cancer risk. And absence of these medications reduces the likelihood of developing colorectal cancer. But again, regular screening and monitoring remain important for early detection, especially when you have family history. I must add, though, genetic testing for conditions like Lynch syndrome may not be routinely recommended for everyone. It's important to consult with a healthcare professional for personalized guidance. I haven't had these tests done myself. And again, I recognize that people may be in a different spectrum of severity. And for them, especially when the root cause is not detected, then eliminating the root cause, going one by one and getting this test done, maybe click the bull's eye and identify the root cause, and then therapies can be started to target that particular problem. And now let's talk about susceptibility and risk biomarkers for inflammatory bowel disease. We've talked about in the diagnosis, prognosis, and many places as well, because IBD is very severe form of gastrointestinal disease and disease. For inflammatory bowel disease such as Crohn's and ulcerative colitis, certain biomarkers can indicate a high susceptibility to these chronic conditions. Biomarkers measures we're talking about three. One, NOT2 gene mutations. Number two, serologic markers like anti-Saccharomyces cerevisiae antibodies, ASCA, interleukin 23 receptor, IL-23R gene variants. My God, these are very difficult to pronounce names. So these NOT2 gene mutations are measured through genetic testing. Obviously, saliva or blood sample is drawn. ASCA is measured through blood test, and IL-23R gene test is measured through genetic testing. A blood or saliva sample is collected. And presence of mutations in NOT2 gene indicates a high risk for Crohn's disease. The presence of ASCA antibodies suggests an increased risk for Crohn's disease and can help differentiate it from ulcerative colitis. And IL-23R gene variant. Certain variants in IL-23R gene are associated with increased risks of developing IBD. And identifying these biomarkers allows for obviously talking about repeatedly for early interventions, targeted monitoring, and personalized treatment plans to manage symptoms and prevent disease progression. An absence of these biomarkers reduces the likelihood of developing IBD. Again, if you have symptoms and family history, regular checkups and monitorings remain essential. It's important to note that while susceptibility and risk biomarkers provide valuable insights, they are not definitive predictors. Some biomarkers have varying degree of risk association, and a combination of factors is often used for risk assessment. Again, that's the reason why these are information purpose only. For accurate diagnosis, consulting a professional for personalized interpretation is crucial. They can help you understand your individual risk and recommend appropriate preventative measures and monitoring strategies.